Hi, I'm Dr. Wayne Burkholz with Total Performance Physical Therapy. Today we're going to go through a technique that you can actually do at home pretty easily. It's going to be a myofascial decompression of the pec major. The cupping sets, as most people call them, are pretty cheap. You can buy them on Amazon, eBay. You can get a fairly cheap set for $30 or less. The set that we use here is a little more than that, but for home use you don't really need what we have. So what we're going to go for is pec major, so it connects up here at the shoulder. Let me give you a slightly better view. There we go. So it comes right here, the anterior shoulder, and then covers the whole chest. So you want to put one up here near the shoulder. You're going to palpate for it. You're going to feel the tension right here. You're going to put a little lotion right there. The lotion gives the cup something nice to seal to. So in this case we use it's a fragrance-free, colorless, no color added lotion, because when we're working on patients, we don't know what their allergies might be. When you're at home and you're working on your family, I'm sure you already know, so you don't have to be as picky with the lotion. So we're going to take the smaller cup, in this case right here. If you have a really thin person where you have a real rounded surface, you may need a cup that's a little bit caved in. I can show you what one of those looks like. So you can see the curve on that one. What we are using is flat. All right. For a cup this size, you're only going to go 1 to 2 pumps. In that case, one looked like plenty. Now, we already checked him. Is it popping off?
Yeah, it's losing the seal.
All right. Give it another one. Give it a little more. Should do it. All right. So on him, he is tighter on the medial pec more than the lateral pec. So we're going to put one on the medial pec first. Once again, just by feeling where it's tight, we're going to go right over there. So you're not trying to rub the lotion in. You're just spreading it out enough that the cup can sit on it and make a seal. Now the bigger cups, you might need a little bit more. So we're going to go 2. 2 should be good there. All right, the third cup acts as your anchor. So there you want to go with the biggest cup that you can get to fit the area that you're going for. We're still going to go in the pec. We're going to go a little lateral. In this case, his anchor cup isn't really a whole lot bigger than what we're using the other cup for, because I just can't go a whole lot bigger and still have it fit where I want it to. But like I said, just as big as you can in the area that you're treating. And you should get a pretty good view of this one. All right. Then grab the camera, give you a nice view of what's going on here. You can see how the skin is pulled up into the cups, and you can see how we're getting this nice white ring around the skin at the base of the cup. That white ring is telling you that it's sealed real nice and tight. So we want to look for that ring. It lets you know that we're able to move and these shouldn't come off. So now we're going to have him sit up, and he's going to do some scap retraction. So this is literally, you're going to put your hands on your legs. Do not move your hands. Just pull your shoulders back and then let it relax. When you relax, do not come front. You're just pulling back and then let it relax. Try not to come up, just straight back. There you go. Don't move the hands. It usually takes a little bit of cueing to get somebody to do it right, and that's fine. So all we're doing here, there is no magic number of how many to do. What I'm doing is I'm looking at his motion. At some point through this motion, you will start to see that he's moving a little better. Initially, it's going to be very restricted because, first of all, you have a tight muscle in the front that's restricting your motion back. Second of all, we just made it even tighter by putting the cups on over that muscle. So that motion is very restricted. So as he's going, I don't know if you can see it from your angle, but he's definitely moving farther now than he was when he first sat up. So that's all we're looking for. You might end up doing this for 30 seconds. You might end up doing this for 3 minutes, whatever it takes to get that motion improved. All right, then we're going to have them lay back down. All right. So now this is the only real tricky part of the whole treatment. So what you want to do is you're going to put your fingernail right on, let me bring this a little bit closer for you. If you look at the top of the cup, you see that orange valve. You're going to put your fingernail right on that valve and just flick it. Just like that. Let some of the air out of it, not all of it. You don't want all the skin to go back down to normal position. Then you're going to use your hand to hold the skin tight, and you're going to move that cup. So right now, if you see the color of the skin in there, it's very, very red, a dark red. It's going to leave a really nasty welt, and it's going to be very sore. By letting some of the pressure out and then moving the cup over that area, we're spreading that edema out, and we're actually going to make that color go close to normal again pretty quickly, and it won't be anywhere near as painful for him later. This part is not going to be comfortable for the patient, but I'm not even going to do it on this one. I want to show you if I don't move it. You can see the color of this one. It's very, very dark, and that one's going to be sore later. We're going to treat it with some instrument assisted later just to make it not so sore. So this one I'm going to do properly. So I'm going to just flick it. I don't know if you could hear that. Now we're going to move it. It started off the same color, and that quick is a totally different color than the one that we didn't do that to. Now the main reason we're moving the cup, one, it helps with the edema, it helps with the pain, but the whole area that you're moving that cup over is now getting decompressed. So we're not just treating the pec right here where the cup was, we're treating the pec everywhere we moved the cup to. So instead of treating an area this big, we just treated an area this big. We're going to do the same thing on our first one. Let some of the air out. And then we're going to move it. Like I said, this is the most uncomfortable part of the whole thing for the patient. I'm not pushing down, I am just moving the cup. And then we're going to release it when we want to take it off. Put that down here. All right, now we already have the lotion on the skin, so it's real easy to just grab your instrument assisted tool and now work over that area. Hold the skin and work it. You can see at the bottom it's already changing color from the top because I'm working from the bottom up. You're going to treat just like you normally would for instrument assisted. You're going to feel for that grittiness. You want to go both directions, feel which way is worse, and then work in that direction. And then move on to the next one. That one's pretty good. And on to the next one. Check both directions, and then treat in the direction of the grittiness. All right, that's all there is to it. If you want to add some heat at the end, that's entirely up to you. Give it a shot. Let us know.